There you go, buddy. As soon as you cover them, they chill out because they're not sure what's on their back. His eye color still looks good.
Yeah, for 16 this July.
Well, one thing that's happening with his eyes is they get a little bit of a moth-eaten appearance because of the loss of pigment in the eye.
That's that cloudy, milky look?
No, the cloudy, milky is different. I'm talking about the iris. You know, he's got blue eyes. He's got a little brown on that side on his left.
Yeah.
But they get little black specks because the pigment is dissipated a little in the eye with age sometimes. The cloudiness you see in the lens, and some of that is secondary to water in the lens, which is what the cause of kind of human cataracts is as well. And so that gives a lot of pets, dogs and cats, this blue eye look on what happens when the water comes into the lens because of a lack of enzymatic activity to pump it out all the time. It gets a whitish, milky look to it. But it does disturb their vision. Although I have to say, dogs and cats don't see as well as we do. Cats see a lot better than dogs, but dogs are essentially blind. Their vision is like at best 2400. They can't read a book and things like that. What they do is they see lateral motion. So dogs like beagles and stuff can be great hunters on the ground. And a few dogs have an ability to see vertically, but the cats see vertically and horizontally very well. That's how they snatch birds out of the sky and things like that.
So Melvin's eyes are looking okay?
Yeah, they look fine.
For his age?
Pretty good for his age. I mean, you get a cat 16, 18, older than him, then they're up there. You know, that's a cat that's 120 years old in human years, roughly, so they're going to show some more changes.
So what are we going to do with Melvin today?
Well, I'm just checking his hydration. He feels good. His skin turgor is really quick, so he's well hydrated. Yeah, I know. Now, Mel's part Siamese, pretty much, since he looks like Siamese. He's got this long body and long tail. And when you hold him up like this, you can really appreciate the body length and such. So it's pretty, this is how, at cat shows, this is how some judges hold him up and look at him like this and like this and all kinds of stuff.
No, it doesn't like the cat show, does he?
Show cats are used to that. He's not. He's also got a little bit of a curl in this ear, and I don't remember if he's had some.
He had a nick, and then it got a sunburn, and
I see. It's a little red. I saw that when I saw him. So wounds will cause the cartilage to go deform like that. But there are cats of particular breeds of. They're called the curls, and their ears do curl up over like this a little bit instead of down. They curl inward. And that's a purebred cat. First thing I always like to do is just palpate their spine. For people who don't know what palpate is, it just means to feel. Yes, I know.
Now, the last visit we had with Melvin, you took out a growth that was on his thyroid. That was a year ago last summer.
Wow, it was just a year ago?
A year and a half. It'd be 2 years, July or August, I think.
Oh, that makes sense. I thought it was further than that out.
Yeah. So he hasn't seen you since then. Would you recommend having your cat looked at once a year or only as needed?
Depends on age.
So Melvin's 16 this year, so should we start doing his checkups every year?
Every 6 months.
Every 6 months. Okay, good. So I'll schedule that next one.
You know,
today.
If they start
At what point should they be seeing you twice a year?
Probably, it depends on their health. I mean, you see some cats, they've got allergy issues and they're not in such great shape. They get into fights if they're more outdoor cats, and then they need to see more often. But on a general health basis, if they're doing well, by the time the cat hits age 12, they're in their 80s, 7 years to 1 roughly. And people will argue that it's a great way to look at it. If oftentimes they'll start showing changes in their kidney function and liver function if they're aging a little quicker than normal at age 12. So it used to be people and veterinarians in general didn't even start being concerned about kidney and liver function until they were 12 or 14 even. Now they've gotten it down to, even at 8 years old, they're starting to look at aging changes like that, and I really think that's not necessary. If the cat's healthy, eating well, looks good, maintaining his weight, what are you looking for? Most of those cases, I would bet, come up normal. Unless you see some problem with an animal, I don't look to see for blood tests and other things. And then again, it's that intuitive hit that many veterinarians with more history and more experience will know this cat's in good shape. You just feel it. Now, I use a lot of muscle response testing, as you know, to detect on a subtle energy level what's off with them, whether they need this or that. In fact, I don't do anything without checking for muscle response, muscle testing to see what's up and to see if they need something or there's something they'd like to have. Now, the cat doesn't think about, oh, I need this or I need that. That's up for us to figure out. Yeah, his eyes look pretty good. Now we're going to look at his teeth. And he's doing pretty well. He doesn't have any significant gingivitis, but I'm going to show you in the back left side where he's got lots of dental calculus, and that's a buildup of mineral on the teeth. Now, when we get calculus, you hardly notice it, but the dentist tells you that. Well, in cats, when they get severe calculus, it's like chunks of mineralized stuff, and I'll show you that right here. Right there, that brown stuff on that tooth. Now I'm going to bring this.
Now
I'm going to bring this towel over him, which makes him feel like he's under. Just a second, I got to get this out of my pocket. That thing's going on.
cut it and start.